Hello and welcome to the Concentra webinar, Mitigating Substance Misuse During the COVID-19 Pandemic. Today's webinar will be presented by Dr. Cori Repp. Dr. Repp is a clinical instructor, conference speaker, and industry spokesperson, as well as a certified medical review officer, American Board of Disability Analyst Fellow, and a certified medical examiner. At the conclusion of the presentation, we will have a 10 to 15-minute Q&A session with Dr. Repp. You can submit your questions throughout the presentation to be answered during the Q&A. Dr. Repp will answer as many questions as possible within the time allowed. A recording of the webinar and a copy of the presentation will be emailed to you after the webinar, so you can view it again at your convenience. Dr. Repp, we're ready to begin.
Anna, thank you so much. And just to confirm, can you hear me well?
Yes, I can hear you great.
Perfect, thank you. Good afternoon. I'm Dr. Cori Repp. I'm the Director of Medical Operations for Concentra in Central Florida. I've been practicing occupational medicine for almost 15 years, and I've been a medical review officer for 13 years, helping employers to create and administer safe work practices, including workplace drug testing. The current pandemic has impacted the workforce in many ways, with employees experiencing multiple stressors, including job and financial security, concern for their own well-being as well as that of their families. With these added stressors, individuals with substance abuse disorders, diagnosed or undiagnosed, in treatment or recovery, are particularly at risk. Extended quarantine times and times away from work with illness of their own or illness of a family member can disrupt the general flow of life. These stressors and disruptions can increase opportunities for substance abuse or misuse. As we go into the presentation, Mitigating Substance Misuse During the COVID-19 Pandemic, there are many factors that can impact the ability of individuals to remain drug-free, especially considering that some individuals, actually 1 in 5 adult Americans, take medication for their mental health. Lack of access, lack of funds, lack of health insurance can cause difficulties with those individuals maintaining their medication and further increase that chance for substance abuse or misuse. So reviewing our agenda for today's presentation, I'm going to speak about why workplace drug testing is important, some of the signs and the symptoms of substance abuse, the benefits of workplace drug testing, when you would want to test, and what to look for when you're testing. The drug testing specimen types. What types of body fluids and body products can we use to test for drugs? How do we collect those test results? We'll talk a little bit about regulated and non-regulated drug testing, as well as what to do if an employee tests positive. We'll talk a little bit about DOT physicals and the specifics above and beyond drug testing that play into those safety-sensitive exams. We'll also talk about workplace drug testing best practices. And after that, as Anna said, we'll have a little bit of time for Q&A. I do want to bring up just a small legal disclaimer. This presentation is intended to be a general overview of workplace drug testing. It doesn't take into account some of the very specific and local regulations, so just please make sure that you have legal advice prior to initiating a drug testing program or making any changes to your existing one. Next slide, please. So why is workplace drug testing important? Well, the National Institute of Health says about $740 billion is lost due to drug abuse and addiction costs. This is a composite of workplace productivity and healthcare expenses due to accidents, treatment, presenteeism, and of people who are diagnosed with a drug and alcohol problem. The Substance Abuse and Mental Health Services Administration, that's also called SAMHSA for short, you'll hear us reference that throughout the presentation, they say that 76% of those individuals currently have a job. And overall, drug abuse trends, they're not going down. Looking at 16% of emergency department patients who were injured at work found to have alcohol in their system. Failed drug testing has gone up substantially, and the numbers that we present to you here, this is the difference between what Quest is one of the largest private drug testing laboratories and reporting agencies, what they found in 2015 versus 2018 In transportation and warehouse sectors, two very sensitive, safety-sensitive sectors, they found a 34.5% uptick. Going into things like wholesale trade, warehousing, construction, substantial upticks there as well. And I would just remind you, look at these numbers from 2015 to 2018. And these were times where the economy was good and things were flowing nicely. We haven't seen any of the data from 2020 yet, but I do anticipate, particularly based on some of the anecdotal accounts I've heard from other MROs, that we are going to see an even greater rise in failed drug tests if we compare 2015 or even 2018, looking on to 2020. Next slide, please. Substance abuse takes a toll on employees, and there are signs and symptoms that can really stand out to identify individuals who may have a problem. Now, I say may because these signs and symptoms, they're relatively general. They're not specific, but things like a lack of focus, poor coordination, declining performance at work, mood swings, when you've got someone who's regularly an easygoing person and is tending to be more angry over minor issues. Individuals with chronic illnesses that appear to flare really often, poor attendance, poor physical appearance, or lethargy, just being tired all the time. And again, these are not specific to drug abuse. These can be signs of many other medical issues, but these tend to be some things that we do see exhibited when individuals have concerns with substance abuse. Next slide, please. So what are some of the benefits of workplace drug testing? Well, you're never going to catch everyone who uses substances that are illicit or uses them in an illegal sense. But when you do drug testing at the workplace, and when you make that well known that you are testing or that you are a drug-free workplace, it can deter substance misuse or abuse at work. If there's someone who's a heavy user or a chronic user, I mean, could they potentially not use for long enough to pass a drug screen? Well, they could. But for a lot of these individuals, it is a lifestyle. And so if they see that a company is a company that drug tests, more than likely, they're going to look for a job somewhere else at a company that does not. The other use of workplace drug testing, you can identify job candidates as well as current employees who have potential drug and alcohol problems. This can be something that you use to reduce work-related injuries and related health costs. Additionally, reducing absenteeism and lost productivity due to issues with substance abuse disorders. One of the big reasons that we do workplace drug testing is because when individuals are intoxicated, they aren't at their best, and they aren't able to be really in tune to everything that's going on. And so it can encourage bad accidents to happen. So, if you want to protect the general public and protect your workforce, workplace drug testing is one way that you can really avoid some of those bad accidents just by ensuring that your workforce is present and capable and aware, and not intoxicated. Next slide, please. So when should we test, and what do we test for, and why would we test? So there's 6 different reasons with some different procedures behind them. These include pre-employment testing, reasonable suspicion, post-accident testing, return to duty, follow-up testing, and random testing. On to the next slide, please. So pre-employment testing, as it says, is done to determine if a potential hire is abusing drugs or alcohol. One of the great things with pre-employment testing is that it's generally accepted that if a job offer is given and the individual does not pass that drug testing, that the offer can be contingent upon that candidate's test result. Next slide, please. Reasonable suspicion testing. So reasonable suspicion testing is conducted when there's evidence that would give us a cause. So basically, if an employee is at work and there's direct observation from a supervisor or another employee that something's going on that really shouldn't be going on at work, something like an odor of alcohol on the body or the breath, slurred speech, an unsteady standing, walking gait, someone appears disoriented or they appear confused, or their behavior just doesn't seem like how they would normally be. They seem a little erratic. Some of the things that they're doing are unusual. Inability to complete routine tasks, basic assignments, things that they would normally be able to do. Now, what you can't use for reasonable cause is word of mouth. You have to be very cautious to ensure that if something is hearsay, someone said that so-and-so maybe was not walking with the greatest gait, maybe stumbling a little bit as they were walking down a completely flat, straight, well-lit hallway. They were tripping over their own feet, and this was kind of unusual. You can't use it if it's a hearsay or a third person, he said, she said, word of mouth information. Now, for regulated employees, that actually is driven also by 49 CFR 382.603, that the supervisors are required to be trained in order to make these observations and document these observations for them to be admissible for reasonable suspicion testing. One thing that may come as a surprise to you as well, voluntary admission of controlled substance or alcohol issues to the DOT does not constitute a violation. So if someone says, I was on vacation 2 weeks ago, and you know what? I smoked a joint. Well, here's the thing. You can't automatically say, oh, well, you violated the drug and alcohol policy, because this is self-admission. Now, the only difference associated with that is if they basically tell the wrong person, and while they're getting drug testing done, they decide to tell the collector, then that would constitute a violation. But if it's just something where someone maybe heard someone else talking about, well, they did this or this, that specifically in and of itself does not constitute a violation. Next slide, please. So post-accident testing, and I think that's something that most of us are very familiar with. This occurs after an employee's been involved in a workplace accident when we believe that drugs or alcohol may be a factor in the accident. One of the most important items that you need to address with this type of testing is that the time frame following the accident should be as short as possible. Now, DOT has specific requirements for the post-accident regulated testing, and if you're outside of those, only non-regulated testing would be allowed or apply. But the employer really must determine when the testing will occur, if the testing should occur, based on their policies, based on the time frame, and definitely with these types of tests, we want to make sure that the test is done as soon as possible to ensure that the substances that were in the body at the time of the accident are still able to be reflected on the drug screen. Next slide, please. So return to duty testing. Now, return to duty testing may not be exactly what you think it is. Return to duty testing is when an employee, specifically when we use this definition, it's for employees who violate their employer's drug and alcohol policy. Return to duty testing is not for an employee who's been off work for some other reasons. And the first one that comes to mind is when someone's been on quarantine for 2 weeks for COVID. Is it return to duty testing when they return? Well, no, not really. That would be more of a pre-employment testing. It would fall more under those guidelines. Return to duty is for violated drug and alcohol policies. Now, the testing guidelines vary for DOT and non-DOT workforces, so that's very important to know. For the return to duty process with DOT, this is conducted periodically after an employee returns to the workplace. After completing the return to duty process, this can include intervention with a substance abuse professional or a staff or some other processes. And this is administered in addition to random testing. And there will be at least six unannounced tests in the first 12 months following the return to duty test for that follow-up period. Next slide, please. So what is random testing? Random testing, by definition, must be truly random, must be a truly random selection process where each employee has an equal chance to be tested every quarter. Now, that can get a little bit tough when you've got a smaller company. Gosh, if you've got only 2 employees, one of them is going to be tested every quarter. So that can get a little bit expensive. One of the great things about using a partnership with a drug testing consortium, you can spread out that cost a little bit more for your DOT random drug testing, and you can join a pool consisting of multiple companies. And so by doing that, it saves you testing costs and time. It really helps you to ensure that you're compliant, because in addition to that, you do have the partner company ensuring your compliance. And it's ideal for owner operators, small companies with a few employees. So again, if you're a two employee company, you don't want to be drug testing someone every single quarter. All right, on to the next slide. So what are we looking for when we're doing drug testing? So SAMHSA, and I told you you'd hear that word again in the presentation, those are the guidelines that require drug tests, regulated tests, non-regulated tests, can be a little bit different, but these are the specific drugs that are tested for, the illegal drugs, prescription drugs, plus alcohol in some cases, that are part of these specific panels. So we go on to the next slide. There are 2 different panels that you'll hear a lot about. The most commonly tested panels are the SAMHSA 5 panel and the SAMHSA 10 panel that are used when we're drug testing. And so these test for a variety of drugs that are illegal and some that are legal. Everything from amphetamines, THC, which is the active ingredient found in marijuana, cocaine, opioids, even the semi-synthetic opioids, which can include legal medications like hydrocodone or oxycodone that are taken with a physician's prescription. Phencyclidine, which is PCP, can be found in other illicit drugs too. There's a lot of combinations that we see that it's popping back up in. Barbiturates or downers. Benzodiazepines, which again can be legal drugs such as Xanax or Valium. Methaqualone or Quaaludes, and methadone, which is often used to treat other forms of opioid addiction. And then propoxyphene, which is Darvon or Darvocet, which is not manufactured, it's not legal in the United States, but is still used in some other countries. Next slide, please. So what do we use to test for drugs? What body substances do we most commonly use? And I think the one that everyone is most familiar with is urine. So urine is the most popular way of screening for drug use, drug abuse. 95% of U.S. workplace drug testing is done with urine tests. Why is that? It's non-invasive. It's very inexpensive. The specimens are easy to get from the donors. They're not invasive, not terribly invasive. And they have a good detection period, generally 5 to 10 days, depending on the type of drug that you're looking for. And the screening that can be done on urine is generally the same, the 5 to 10 drugs of abuse. So the things that we went over, like the amphetamines, methamphetamines, barbiturates, benzos, cocaine, marijuana, MDA, opioids. One of the things, like they bring up 6-MAM here, that's indicative of heroin use. That one is actually out of the urine within hours, so that can be a really tough one to capture on the urine drug testing. Hydromorphone, hydrocodone, oxymorphone, oxycodone. So when you're looking for, is someone maybe taking pain medicine that they're not prescribed? Nicotine and alcohol can be tested on that as well, even though those are not part of the SAMHSA 5 or 10 drug panels. So urine overall, it's a good specimen in terms of the lack of invasiveness, in terms of the cost and the ease of testing, and the variety of things that you can test on it. The big problem with urine drug testing is substitution, adulteration, and really just ensuring that the specimen that you're receiving is the specimen from that person giving the sample. So those can all be some of the downsides of urine, and that's why it's really important when you're looking at any type of drug testing to make sure that your collection site partner has very well-trained collectors. And I would say that applies to all of the different specimen types, to ensure that your collection site has well-trained, certified collectors. And at Concentra, we're very on top of that to ensure that our collectors are all well-trained. Anytime there's a positive drug test and someone loses a job or a benefit due to that, it's very common to have those be litigated. And the first thing the attorney always asks for, the chain of custody and the testing from the lab. So those, it's very nice to know when you have a partner who is very in tune to ensuring that all of those are all the I's dotted and T's crossed. Next slide, please. Oh, is hair? Sorry, I didn't see that you switched on me. Hair testing is another drug testing specimen type that we can do. It's highly effective when you've got a safety sensitive position where you really can't take the risk that this individual does drugs at all. It's a great specimen to use for that because it detects drugs in the hair for about 90 days post-use. Now it's costly, and you always want to use the urine test as a backup with it. Hair can be used to detect drugs like cocaine, marijuana, opioids, amphetamines, ecstasy, PCP. Could even be used to determine alcohol use. And in a regulated setting, so specifically for DOT regulated testing, it's not something that we're using currently in discussion, possibly something that we'll see coming about in the next year or two. But if you've got those safety sensitive positions where you absolutely can't take the chance that this individual ever uses illicit substances, the hair testing can be a really good option for that longer detection period. Next slide, please. The next specimen type that we can do substance testing on is blood. Now, blood draws are relatively invasive. They're not the most popular way of testing because they are invasive, they are costly. There's a very short detection period for blood. So these blood tests are best used in a situation where you need to know the intoxicant potentially level or the intoxicant specific to the time of an event. So blood can be used to detect things like alcohol, very commonly used for alcohol, amphetamines, cocaine, fentanyl, marijuana, heroin, one that's out of the urine very quickly. You can use it for PCP, nicotine, tramadol. So there are many drugs that can be tested for in blood, but it's not something that's approved for routine regulated testing, and definitely something that you want to ensure that if you're using it for a drug testing protocol, that the proper chains of custody are sent with that specimen. Otherwise, it's a medical specimen and inadmissible. So again, it's a reason to definitely want to ensure that you have a partner who knows the needs of your company and that knows the regulations and has the certification to produce this type of specimen. Next slide, please. So one of the more up and coming drug testing specimen types, one that I really like in particular is saliva. And the reason I really like it is because it's not invasive. Even a urine drug screen is somewhat invasive in terms of an individual's privacy. But with saliva, this is a very simple swab. It looks like a toothbrush. And depending on the manufacturer's kit, some of these can take just a few seconds. Some of them take up to a minute. And whoever you're giving that toothbrush to and they are inserting it in their mouth and getting that swab, you are guaranteed, as long as your collector's checking the ID on that individual to make sure that it's the right person doing the swab, you're guaranteed that the specimen is coming from the person that you're testing. Also, it avoids that darn shy bladder where somebody's sitting around for 3 hours trying to produce a specimen. Sometimes they can't, and then you've got additional workup if they can't with shy bladder. You don't have that as much with saliva. There have been discussions about dry mouth concerns, but in general, it takes very little saliva to produce enough of a specimen to be tested on the swab. Saliva also has a shorter detection period than urine. It's not quite as long in the detection period. Right around 3 days is what they consider the maximum for most of the specimens or most of the substances that we're testing for. Very similar panel of drugs, drugs of abuse and drugs of misuse that we can test for. The alcohol barbiturates, the benzodiazepines like the Valium and Xanax, things like cocaine, ecstasy, marijuana, opioids, amphetamines, PCP, methamphetamines. One of the drawbacks of saliva, though, at this point in time, is that saliva testing is not approved for regulated testing. We don't really have an idea of when it will or if it will be. But again, for those concerns that are not regulated or not DOT driven, it can be an alternative that again stops the concern as to, well, was the specimen really from this donor, or was this really the donor of this specimen that we're testing? So it can really help with stopping that from ever being a question. Next slide, please. So how do we collect the test results? Well, there are rapid tests that can be performed. These tests can be done on urine or saliva. One of the great parts of rapid testing is that it allows the detection of drugs that metabolize quickly. So like we were just talking about heroin that's broken down and metabolized and pretty much out of the specimen within a few hours, that one you may not be able to catch at a later screening. So the rapid tests can really pick up a lot of those types of substances. The great thing about rapid tests, they can be performed at an employer's workplace. They can be performed at a clinic. And they generally take about 5 minutes for the procedure to be performed, 5 to 10 minutes. The only thing that you have to remember with rapid testing is that rapid testing is a screening test. So if you get a result that's negative, that's wonderful. Negatives are negatives. That individual can return to performing their duties again. The problem comes if you get a rapid test that isn't negative, if it's a non-negative. The non-negatives still need to go to the lab. They still need to go through the MRO process, because just because something is non-negative doesn't mean that the individual doesn't have a prescription for the substance that's showing on the cup or the slide. And sometimes, fairly rare, but it can occur, that sometimes the rapid tests are showing substances that aren't even drugs of abuse, that could be showing up as a false report or a false reaction on the strip that's a part of the drug testing cup. So, and sometimes there are, very rarely, but there can be failures of the strips themselves. So it's really, really important to not just take those non-negatives and say, hey, this is a positive, because it's not. It's not a positive until the lab has run that test and the MRO has reviewed the results of that test to ensure that there isn't another explanation. And again, very nice to have a partnership with a lab, with a facility like Concentra, where we can support those types of tests. All right, so next slide. Let's talk a little bit about the differences between regulatory and non-regulatory drug testing. Regulatory drug testing, a lot of times you'll hear this referred to as the DOT drug testing. Basically, it's safety-sensitive workplaces. They fall under the Health and Human Services or the Nuclear Regulatory Commission Testing Authority, Department of Defense, or they're part of the DOT. But these are all grouped into the safety-sensitive workplaces. So these are folks that you really, really want to make sure that they're not doing any type of drugs. So, these agencies, they basically didn't leave it up to the individual employers. They made their own set of rules to ensure that drug testing is being performed. So these are your FAA folks, like your pilots, the pilot piloting your plane, Federal Motor Carrier Service Administration, so the folks who are driving the big trucks, Railroad Administration, self-explanatory, Transit Association, Pipeline, and Coast Guard. So these are individuals who have the responsibility of safety of a lot of folks behind them. So you just really want to make sure that these are individuals who are in the testing program. And so the government does regulate or basically give the formula for how these drug tests are done, how often they're done, and items like that. And typically these are urine or breath alcohol tests and performed by the regulations of the different entities. Next slide, please. So what is non-regulatory drug testing? So non-regulatory drug testing is really just that. It's any non-DOT, non-regulated drug test that the employer is choosing to use. Now, non-regulated does give employers freedom to design the drug testing program without the requirements of the federal government that those industries that we just discussed have. You can choose the type of specimen that you want to test. You can choose the panel, whether you want a 5-panel or a 10-panel or a custom panel to fit your needs. And it can be done electronically. The chain of custody can be done by paper, whatever you choose. But whatever you choose doesn't mean that you're completely free in this. You still have to be aware of the different jurisdictions. So the states, the municipalities, federal laws still apply. All these regulations and laws that are very specific, not only potentially to a bargaining agreement or a local municipality or a state's laws. And, I think about this a lot when we talk about things like marijuana testing, THC testing, the non-regulated drug testing. We do have to be a little bit more sensitive to that. And there's a lot that's specific to geographies that you want to really take into account before you develop those programs. And of course, very important to make sure that those programs are written and that they are applied equally and fairly to all employees. Next slide, please. So what do we do if an employee tests positive? Well, it's different between DOT regulated and non-DOT regulated, as I'm sure you realize. DOT regulated, there are federal guidelines that have to be followed for the positive test. And the first most important thing is to make sure that that employee is removed from the safety sensitive function. Now, that may seem pretty that may seem like it's a pretty logical thing, but unfortunately, I have seen cases throughout the years where that was not done, where someone was testative, maybe had a non-negative, and they were sent back to work. Like, oh gosh, why would you do that? But that's one of the big parameters with these safety-sensitive functions. You need to make sure that you're removing that individual from the function they perform, and make sure that you inform the employee not only of the results of the test, but that they need to seek help from a substance abuse professional, and they need to enter substance abuse treatment and give them their options. Now, the regulations don't prohibit termination of the employee if it's permitted under the employer policies. So that would be part of your policies, part of your bargaining agreements, etc. The worker who tested positive is still obligated to complete the return to duty process, as we discussed before, with those multiple drug screens. And really, who pays for this is determined by the employer's policy, collective bargaining agreements, state and local laws, but there's definitely a process in place for those individuals if there's a positive test. Now, for non-DOT regulated employees, this is where the employer's written policy is so critical. It's very important to have a written policy. It's also important to document that positive test result was given to the employee, and then refer back to the relevant state and local laws. Of course, defer to your corporate counsel or your HR advisors to make sure that all of that the way that you're operating based on those results is corresponding to what your state and local laws are. But I can't say enough about how important it is to have that written policy. Next slide, please. And then on to DOT physicals. So with safety-sensitive employees, they're required to have regular physicals with DOT drivers. It can be anything from 3 months, 1 year, up to 2 years that they're cleared for. The DOT physicals are regulated by 49 CFR 391.41, and the clinicians who evaluate the drivers are NRCME certified medical examiners. So what does that mean? So for these individuals, we're looking at not only are there potential signs or symptoms of drug abuse, what medications may they be on that could impair their ability to work properly, function properly in the high demand job that they have. So all of these items are taken into consideration, along with any medical concerns that could become safety sensitive issues. So if you've got an individual who is falling asleep at the wheel, the medical examiner is going to absolutely dig into that and make sure that is addressed prior to that individual ever getting a card or certification to continue driving. If someone's on a medication that can cause sedation, we're going to look into that. if something is a safety sensitive concern with the medication that they're on, medications, that may not even be regulated drugs or drugs of abuse, things like perhaps Chantix. Someone's trying to stop smoking and they're taking Chantix, and we raise a red flag with that. The medical examiner maybe asks some questions and is concerned about how well that individual is coping with the initial side effects of the medication. There are a lot more items that the certified medical examiners are digging into to ensure that those drivers are safe. So there may be reasons beyond just substance use or misuse that would be a concern for DOT physicals and for the medical examiners. And with Concentra, all of our clinicians who perform DOT physicals are certified medical examiners. So they are very aware of those parameters, the needs that the drivers have, the demands of those positions, and all of the guidelines that indicate some of the things that we might want to watch out for impairment, not just impairment for substance, but other ways that an individual can be impaired, just to make sure that the roads are safe and to ensure public safety. Next slide, please. So some workplace drug testing best practices. I know that all of you on the phone are here because you care about your industry and you know your industry, but that is the most important factor. Make sure that you know your industry, know what your requirements are, know what you're required to produce for any regulations that you may fall under. Know your local, state, and federal testing guidelines. And you know what? If you don't, that's okay. Make sure that you have a resource available, someone who you can go to. Drug testing laws vary greatly by state, especially in regards to THC. So that's just one that even if you're not a regulated entity, just be sure that you have a resource that you can go to ask those important questions and to develop those drug testing protocols. Make sure that your workplace substance abuse policy is in writing. Make sure that it's very specific. And again, work with your partners to ensure that it's been reviewed and that you have a second set of eyes on that. You want to make sure that your written workplace substance abuse policy is absolutely ironclad, that it's applied fairly and evenly, and just really make sure, I hate to say it again, but make sure that everything is in writing, because that's the first thing, one of the first things that would be requested if there were a challenge to the policy. Make sure that your policy is explained to your leadership, that they're trained on what your policy is specifically, and be sure that that training is documented. Very important there. And then if you're going to have this policy, if you're going to write this really specific, really great workforce substance abuse policy, as we discussed earlier in the presentation, the most important thing is that your workforce understands that there is a substance abuse policy, that they understand the guidelines, that they understand if there's a random testing program, they need to be aware of that so that it doesn't come as a surprise. And again, it's more of a deterrent with random testing and with many other types of drug testing. It's a deterrent to keep those individuals from using illicit substances or misusing substances. Someone may be at a party and their friends have some marijuana cigarettes, and they're thinking, well, gosh, I could do this, but if I go to work on Monday, I might test positive and I might lose my job. So it really encourages that thought process and helps to dissuade drug use more than anything. Be consistent in your efforts to enforce policy. So if you're going to be starting a random program, or if you're going to be doing drug testing for reasons X, Y, Z, just be sure that those efforts are implemented. And in particular, if you have a policy that says, well, if someone's on PTO or if someone's not available to get the test, be sure that you're addressing how that's followed up. And last, but certainly not least, partnerships are critical when it comes to workplace drug testing. Be sure to partner with an occupational health provider, not only to structure your policy, ensure testing compliance, but to ensure that there is that extra layer there to really help make sure that when you're getting these tests done, that, if there's ever a challenge to your test, you can sleep well at night knowing that the chain of custody is properly filled out, that it's legible, that all of your drug screeners that you've used through the partner that you're using, that they've all been trained appropriately, and that's an ironclad defense for you. So, again, I can't say enough. Partnership is really critical in workplace drug testing, because at the end of the day, positive results are going to be challenged. They very commonly are, because there are generally, benefits to the individual donor that they're going to lose if they have that positive test. So just be sure that your partner is able to support you and provide for what you need with workplace drug testing.